There's really only one way I can deal with big bulging varicose veins like these, and these, and that's to perform a micro-phlebectomy. Now, this is a fancy medical term to indicate that I make a very small nick in the skin, slightly bigger than a needle prick for a blood test, and then using micro instruments I actually remove the vein or extract the vein. It's all done under local anaesthetic. It's all done with very precise, very small and delicate instruments. Now, a lot of people get confused and they think this is surgical stripping. It is confusing. I don't do surgical stripping anymore. It's an outdated, archaic technique, in my opinion. Surgical stripping was the procedure that was done in hospital, in an operating theatre, under general anaesthetic. A cut is made in the groin or behind the knee. The main refluxing vein is tied off, and then a piece of surgical wire is put down the vein to actually pull the vein out. Now, we have better treatments for superficial vein reflux that avoid surgical stripping. We have endovenous laser, radiofrequency ablation, and ultrasound-guided foam sclerotherapy. But the side branches of these refluxing veins that come right up to the surface and appear as these bulging varicose veins can only be really dealt with by micro-extraction. Now, this is the bit that most people feel a little bit squeamish about. It is done under local anaesthetic. The local anaesthetic injections are a little uncomfortable, but the procedure itself is pain-free. Now, I'm going to show you a video of the technique that I use, and I would recommend that if you are of a nervous disposition, you perhaps decide not to watch this video. Here's the procedure as performed by me. I start by examining the patient standing up, and the bulging varicose veins are marked with an indelible pen. The patient can then lie down on the treatment couch, and I anaesthetise the area with local anaesthetic injections. I then use a 1mm dermal punch, which is a very precise instrument to make a 1mm nick in the skin, through which I can use delicate instruments to extract the vein. The local anaesthetic used contains adrenaline. This causes the veins to collapse and go into spasm, and there is no blood in the vein as it's extracted. It makes the procedure much easier. The patient will feel a mild tugging sensation, but the procedure is completely without pain. By delicate and patient removal of the veins, an excellent cosmetic result can be assured. The little tiny nicks are only 1 millimeter in size and heal extremely well. Now I'm going to show you the results. I'm going to show you a series of photographs, clinical photographs, which have been taken before the procedure and in all cases 6 weeks after the procedure, so you can judge the results yourself. Now, I would point out that I take clinical photographs in all cases, and it's only with the expressed and written permission of my patients that I show you these photographs. Let's have a look at the results. Now, this gentleman had very severe varicose veins on his calf, and these were treated by phlebectomy, as well as treatment of the superficial venous reflux. Now, all these patients have given their permission because they're very pleased with the results, and in all cases the results are shown 6 weeks after treatment. In many cases there is a little bit of bruising, but it's very hard to see the little tiny nicks where the veins have been extracted. For many people, the results can be very impressive indeed. And it's possible with local anaesthetic to treat both legs at the same time in one visit. Men as well as women are affected by varicose veins, and they often seek treatment for cosmetic reasons. So there you are. That's how I perform micro-phlebectomy under local anaesthetic. Now, if you have superficial vein reflux and big surface bulging varicose veins, it's quite likely that you're going to need a combination of treatments, perhaps laser or radiofrequency for the reflux, but also micro-phlebectomy to the bulging varicose veins. If you have a question about your varicose veins, I'd be very happy to hear from you. Thank you for watching.